Hello, this is Dr. Erica coming back to you on today to talk about the new transdermal dextroamphetamine transdermal patch. It is a central nervous system stimulant, and it's usually in tablet form. It comes in tablet form and it comes in capsule form, but newly approved by the FDA. It is now a medication that is transdermal as a patch, and it's called dextroamphetamine. Brand name is XELSTRYM, and it is in the title of this video chat. And those who would like to see more content or have a suggestion on what topic they would like to learn about, please let me know in the comments section. It is, back to our new medication, it is indicated for those who are 6 years of age and older, and also it is indicated for adults. It is not indicated for those who are younger than 6 years of age because of the risk of weight loss and decrease in appetite. So we want to stick with the research and the studies that are standing behind the medication. And those groups that were studied were those pediatric and those are adults. So this particular medication has been on the market for a long time, dextroamphetamine. What we do know about dextroamphetamine is that it is a stimulant, again, of the CNS or central nervous system, and that it does cause a dependence, a type of dependence. It can be abusive or it could be mild, but usually patients over time typically do not come off of this particular medication. So this medication is a prescription medication. It's controlled, and it's controlled to the highest extent, which is this, level 2 control that is able to be prescribed. And so this medication is kept in the pharmacy in behind the pharmacy counter in safes and in protective coverings because of this known abusive behavior that it can cause. And so I want to also make mention of amphetamine salts. They are medications that are for ADHD or attention deficit disorder. Helps to keep the mind and the mental state active and stimulated throughout the day, helps pediatric patients to focus while they're in class and studying, and help them to maintain behavioral habits that are acceptable. And so this medication is what it's usually used for. And like I said, most patients do not come off of this medication, so they continue with this medication in adulthood. So just to make mention of that. Okay. Now, some of the cautions or warnings for taking this medication, like I said, is weight loss, growth suppression, serotonin syndrome, skin reactions or redness, edema, um, or arrhythmia, not arrhythmia, but erythematosus, and also 2 days of skin redness has been seen or reported, and also a change in psychosis because most of these patients are either bipolar or they've had some sort of diagnosis of psychosis. Also, there's a warning of sudden death, or structural cardiac abnormalities when taking this medication can cause a sudden death, such as arrhythmias, coronary artery stents, structural deformalities of such that are in the cardiovascular system can cause a sudden death. So we want to be cautious in those groups of patients. And then also there's a total contraindication against patients who are taking monoamine oxidase inhibitors. Also, patients who have a hypersensitivity or allergic reaction to the medication should not take this medication at all or at any time or point. So before considering this class of medications, do or use of this new patch do inform the prescriber as well. Some of the side effects that are known with the dextroamphetamines is going to be the decrease in appetite, loss of sleep or insomnia, dry mouth, can be diarrhea and anxiety, also nausea and vomiting as well. In pediatric patients, side effects are blood pressure increase, heart rate increase, decreased appetite as well, headache, insomnia, abdominal pain, and irritability. That goes with that change in psychosis that I mentioned. The patch, it comes in 4 different strengths. Lowest strength is going to be 4.5, 9 milligram, 13.5 milligram, and an 18 milligram patch. Okay, and this is available through NOVEN Therapeutics Pharmaceuticals. So that's all the information that I have today on the new XELSTRYM dextroamphetamine transdermal patch. And it is available as of January 16th of this year, FDA approved, and so it can be ordered. It can be ordered through the World Wide Web, and it is readily available. So do check that out. I did go to the website. I was able to look at the website information, and it is proudly displaying all of the pertinent information and research behind the new patch that is out. So I've worked, just to give some more background information about my experience as a registered pharmacist. I've worked with amphetamine salts, dextroamphetamine, lisdexamphetamine. I've worked with all kinds of controlled drugs, even the highest controlled drugs, and that would be the C2 drugs. So I have been able to dispense and work with physicians on prescriptions for those medications, and most of the people that do take these medications have been on them for a long time and are aware of the side effects and have adjusted properly. So it is I give it a thumbs up, and I do recommend it for patients who are dealing with irritability, focus issues in the classroom, or behavioral issues as well. And I do recommend this class. So that's all I have for dextroamphetamine, CNS stimulant, XELSTRYM. Thank you for joining me. I'm signing off. This is Dr. Erica. Please like and subscribe. Like and subscribe. I would like to reach 1,000 subscribers within 2 months. So starting yesterday. So thank you for joining me, and I hope to see you on the next video. Take care. Bye-bye.